Good afternoon, everyone. Wow, it's pretty much end of the day. Yeah. And I'm here at the University of Sciences. I'm a professor of pharmaceutical sciences, and I teach medicinal chemistry. Actually, quite involved in the research program in drug discovery in the Alzheimer's disease area, and also teach pharmacology to pharm-based students, to other pharmacy students, to BS students and PhD students. In the forward-thinking manner of Investor Kill, when I was of course invited to present at this meeting, I was asked to think about a question that just came out. There was a lady here, somewhere in that angle there, who asked a question about, my uncle had it, my dad, Adeboye, and so on and so on. So, what are my odds? So, what they wanted me to do was talk about the what do we know right now, if based on science, to how to prevent Alzheimer's disease, based on what is the science out there. So, the talk is on science of prevention, the 5 Alzheimer's positive habits. Now, there are of course, many habits, but when you start to get to number 78, people lose track of exactly what are you talking about. So we're going to talk about only 5. Not that those are the only 5, but those are what I would say possibly top 5, and then there are many more that come. And then at the end, I will also talk a little bit about youth sciences, because I've asked some questions about youth sciences, for the location and how come the conference ended up at youth sciences. So I'll spend a few minutes on those. Okay, so top 5. One of the questions that people have is Alzheimer's disease type 3 diabetes. Now, one of the presenters talked about leptin, and how I did not know that before, and I just met him today, and I just listened to his talk for the very first time today. But there's a lot of discussions ongoing about is Alzheimer's disease type 3 diabetes. A couple of years ago, NIH began a study, which is study of basal insulin to fight forgetfulness. Okay. Basically, is to find out, we know in Alzheimer's disease there is some kind of glucose metabolism dysregulation. Okay. Now, can insulin actually be of help? So that's what NIH started this clinical trial on. Okay. Hopefully, you can see the links in case you are interested. Okay, this phase 2-3 clinical trial will examine whether a type of insulin, when acted as a nasal spray, improves memory in adults. So this will answer some of the questions about the link between Alzheimer's disease and diabetes. Okay, fine. The study, according to the NIH website, that study should have concluded in December. And so, hopefully, this year, or certainly within the next year, we will get results from that study, which is led by Susan Kraft and Paul Aisley. And that will begin to address the question of the link. Now, somebody might say, okay, if Alzheimer's disease is a type of diabetes, how come that people that are already, diabetic and are on insulin and they're taking insulin injections, insulin pump, how come, they still have AD? The problem is brain bioavailability. if you, certainly 50 years later, we still don't have an oral formulation for insulin. Okay, if you take any peptide or protein, chances of it being absorbed is minimal. If it ever gets absorbed, it's going to be degraded by all kinds of peptidases, right? Just like the peptidases don't know that this is an important molecule. They will just grind it like meat. So so it doesn't get into the brain. So somebody could be on insulin, and still have AD because the insulin they are taking, even if we eventually find out that yes, it's likely diabetes because the insulin right now we do not have mechanisms for that upon injection to cross the blood-brain barrier. That issue will still be there. Many more studies will be conducted over the years, and hopefully this will be led by NIH, so it will be fairly independent, and then we can rely on those kinds of data. So what can you do in the meantime? Make sure that your blood glucose level stays within clinically acceptable range. So whether it's diabetes or not, we'll find out. But let's just be conservative about that. So that's number one. Number two, somebody can say, wait a minute, I heard about cholesterol and AD. Is there a connection? Yes, there is a connection between the two, but we do not really understand that connection. So there have been clinical studies using statins, okay, and but the studies did not. We did not find positive benefits in the studies, in general. What was found was that some people saw benefits, others saw opposite effects. So how do we know who will benefit and who will not? Right now, we are looking at the criteria of who will benefit and who may not necessarily benefit from those kinds of studies. For now, we'll say, okay, make sure that your lipid levels stay within clinically acceptable range. For that, it's easy. There are a lot of guidelines that have come out from cardiovascular studies, right? Okay, what is good for your heart is also good for your brain. So let's just follow those. Let's make sure that the HDL is as high as possible and LDL as low as possible. So that's habit number two. That'll be good. Number three, lots of studies, and I put in all these links that anyone that's still can look at, have shown that exercise does the body good. Well, not just body, but mind too. Okay, so lots of studies are showing this. NIH just began a study that's going to end in July 2020, where they are actually measuring a lot of all the biomarkers. And addressing the question that can exercise actually be curative? Okay, so that's ongoing. Hopefully, next year, towards the end of the year, we should be able to see some benefits from those studies. Let's just look at this. This will take us to those studies. Okay, exercise in adults with memory problems. So that's called the EXACT study. You can see, exactly the inclusion criteria, the exclusion criteria, what they're measuring, and all that kind of data. That's all available. Okay. Okay. There's also one of the speakers mentioned something about Alzheimer's disease cooperative study, ADCS, which is an agreement between NIH and UCSD. And through this agreement, they're able to do or link a series of clinical studies that address the same problem. Okay, so EXACT is a national 18-month clinical trial. So we're going to test whether physical exercise can slow the progression And so, what are the kinds of things they're going to mention that they're going to measure? Cognition, functional status, brain atrophy, blood flow, CSF biomarkers. So this is going to really, when this study is finished, this will tell us quite a lot about the importance of exercise. They're even going to look at the intensity of the exercise, whether we are looking at just strength balance versus aerobic. So by the end of that study, we should be able to know quite a bit about how those relate to Alzheimer's disease. Okay, so significant body of literature exists that talks about the benefits of exercise. So, if you're looking for prevention or addressing AD, exercise. So, lesson number 3. Lesson number 4, neuron. Use it or lose it. Okay? It's very important, and in studies upon studies have shown that it's important to be intellectually active through the years. Like what? Okay, you're going to be reading, writing, learning something new. So we are constantly making use of those neurons, so that's very critical. You've heard a lot about inflammation, right? Today and its contributions. As of today, there have been clinical trials using some NSAIDs to try to see if they address AD. There is no FDA approved, drug in that category. But the brain could benefit from any antioxidants that you may be taking or NSAID. The last habit, I took this from a Jamaican saying, which is "Don't worry, be happy." And then at the end of the day, you're going to be a little bit on a lighter mood. Studies have shown maintain your social network for as long as possible, because by being social, you're still making use of those neurons. You're still coordinating things, and so that's good. Red wine will do good, same as fruits and vegetables. Or part of the thing using these antioxidants. There's also been talk about faith, meditation, faith. And you say, wait a minute, how does your faith play a role? Okay. There is evidence that there is stress reduction due to faith. If you believe that this is the will of God or will of Allah or whatever you believe in, then you are less stressed about the situation, which means that you have less reactive oxygen species being produced, right? Which means it's a way to address the situation. There are many ongoing NIH clinical trials about going on right now, and these will help us to better understand the roles of non-pharmacological interventions as the years go on. So, giving hope to all of us in this field. Last, I have only a few minutes left, so I'll quickly acknowledge NIH. Thanks for paying your taxes, because this is that's how NIH gets its money, and we all benefit from that. Investor Cure. About 18 months ago, I got a call from Max, and he said, they have found me on the internet. I think I put together a book on drug discovery for neurodegenerative disorders, especially on Alzheimer's disease. And I think, in doing their research, they had found my name, and then so they came and talked with me and invited me to be on the scientific board for the company. So I'm happy to do that. And it's very befitting that this first conference is happening here at New Sciences. You may say, wait a minute, what do you mean? Many people know us as the Philadelphia College of Pharmacy, PhD. This is the first College of Pharmacy in North America. And just FYI, this is the home of Eli Lilly and the son. This is the home of Heroes and Welcome, the home of McNeil, Tylenol, not a bad word, right? At least not on this campus. This building that you are sitting in is actually is called the McNeil Science and Technology Center. Okay, thanks in part to Tylenol, right? Okay, or to McNeil for opening this building. Actually, I was at the presentation when the building was opened several years ago. So it's very befitting for this conference to start right here at Sciences, and hopefully we'll see you all again sometime soon. And as the last slide, thank you all, and I guess we'll wait for general discussions or questions.